Hi, I'm Dr. Ragu. I'm a colorectal surgeon. March is a Colorectal Cancer Awareness Month. I would like to highlight to you about colorectal cancer and the importance of screening and early detection. Colorectal cancer is a cancer that arises from any part of your colon and rectum. When people ask me about risk factor of colorectal cancer, I usually divide it into non-modifiable and modifiable risk factors. Non-modifiable risk factors is what you're born with. You cannot change who are your parents, what is your genetic lines. So this is something that you are born with. Modifiable risk factor is something important, we can all modify it. So something like smoking, drinking alcohol in excessive manner, and also taking too much of red meat, reduce in your intake of fibers, and all this can increase our chances of getting colorectal cancer. Early signs, I would always say, is never early enough. Do not wait for early signs of colorectal cancer, but the early signs will be you having abdominal pain. The other symptoms that people always get is that they have colorectal bleeding, or what we call in bahasa as berak berdarah. And this is something that people always take it as hemorrhoids. The other sign and symptoms is when you have delay. That means you could be having abdominal distension, difficulty to pass motion, and patients can also be having altered bowel habit. That means sometimes you could be having diarrhea, sometimes you could be having constipation. And these patients usually used to have a regular bowel movement, and now there is a change in their bowel patterns or going to toilet patterns. Well, there's a lot of things that we can do, but I think this is something that everybody knows. We should be taking enough fiber in our diet. We should be taking a good amount of fruits, vegetables. We can also modify certain risks like exercise, reduce our weights, because obesity is also one of the risk factors for colorectal cancer. Screening is something very important in colorectal cancer because early detection saves lives. Colorectal cancer is one of the highest number in Malaysia among men and number 2 among female. So screening is something very important. The methods of screening can be simple as IFOBT. That means immunohistochemical fecal occult blood test. That means we are just taking the stool and we are checking whether there is blood in it. But these are the bloods that we cannot see. And these test kits are available to check for this. But we still can miss colorectal cancer by doing this. But this is one of the things that we can do as simple as that. The other method which become a gold standard in detection is colonoscopy. So the good thing about when we do a colonoscopy, we are detecting a polyp. So this is where the importance of screening comes. When colorectal cancer usually begins from a small polyp, and these polyps, when we do a colonoscopy, we can take it out. It's a small thing that we can either pick it up and just send it for histological, or we can even cut when it's big enough. And when we do this, and the patient has not developed any form of dysplasia, and save them from having a colorectal cancer. When we talk about treatment options of colorectal cancer, we can divide it into non-surgical and surgical. So when you come early enough, we always, for colon cancer and rectal cancer, there's a difference in management. In colon cancer, is usually surgery. But it differs from a rectal cancer. Remember, colon and rectum, they together form your large bowel. So in rectal cancer, we can offer them surgery, or if you come delayed, sometimes doctor will suggest for you to do a chemoradiotherapy.